let's now talk about the muscarinic antagonists. The muscarinic antagonists are drugs that are blocking the effects of acetylcholine. Now, their effects are going to mimic the sympathetic nervous system because the parasympathetic nervous system will be turned off. Some muscarinic antagonists have the common ending tropine, but many do not. Unfortunately, you may just have to memorize the names, but they all are going to block acetylcholine binding at the muscarinic receptors. Now, I've already introduced atropine as a way to block excess acetylcholine through muscarinic antagonism. So what are some characteristics of atropine? Atropine is a prototype drug. It has a long half-life and it crosses the blood-brain barrier. Homotropine and tropicamide are similar drugs, but with shorter half-lives and therefore are more useful in certain clinical situations. They all are going to produce mydriasis and cycloplegia and can be therefore useful clinically to dilate the pupil during a fundoscopic exam. Atropine can be used to treat bradycardia. And finally, remember we just talked about atropine being used to treat acetylcholinesterase inhibitor poisoning, so it can be used for that as well. Now, benztropine is a muscarinic antagonist that is going to be used for the treatment of Parkinson's disease. So let's quickly talk about the neurology topic of Parkinson's disease. We've got our little teeter-totter here. Parkinson's disease is due to the loss of the dopaminergic neurons and excess cholinergic activity. So dopamine we're short on, so it's going to be light, while we're going to have excess acetylcholine activity. So how does benztropine come into the picture here to treat Parkinson's? Benztropine helps blunt the excess acetylcholine, which contributes to the symptoms you'll see like rigidity, akinesia, tremor, and postural instability. Now, the mnemonic that I remember this by is Park My Benz, where Park stands for Parkinson's disease and Benz for benztropine. Scopolamine is a drug that acts in the CNS and is typically used for motion sickness. Ipratropium is used to reduce bronchial secretions in the treatment of asthma and COPD. It's often given in combination with albuterol. Remember the mnemonic, I pray I can breathe soon. Does ipratropium work the same as albuterol for the treatment of asthma? No, it's because each drug has a different mechanism of action. Albuterol works on beta receptors, while ipratropium here works on muscarinic receptors. We'll discuss albuterol in a bit, but for now, just realize that ipratropium is going to block the M3 receptors, which is going to prevent the bronchoconstriction, and thus allow people with asthma to breathe better. We've also got oxybutynin, which is used to reduce urinary urgency in mild cystitis and bladder spasms, while glycopyrrolate reduces airway and stomach secretions. Now remember that all of these muscarinic antagonists will antagonize or block the effects of acetylcholine. When this happens, you're going to decrease secretions from the body or block the wet picture. Alright, let's tie all this together with a flash quiz. A female complains of urinary urgency from frequent bladder spasms. Which muscarinic antagonist can reduce the urgency in this patient? It's one of those drugs that we just covered. The answer is going to be oxybutynin. Oxybutynin is a muscarinic antagonist that is going to be used to treat urinary frequency or urgency. Make sure you're going to be familiar with these muscarinic antagonists and know how each one is used clinically for test day. Alright, let's now talk about atropine. As I briefly mentioned before, atropine is a muscarinic antagonist. We also discussed its use in acetylcholinesterase inhibitor poisoning. So now let's discuss some details now, because atropine is going to be a major player on the USMLE Step 1. It's easy to remember atropine's effects if you think of it as the opposite of the parasympathetic nervous system. So opposite of the parasympathetic system. Alright, so in the eye, it's going to cause pupil dilation and cycloplegia. So what is cycloplegia? It's going to be a fancy term for paralysis of the ciliary muscle, which results in a loss of accommodation of the eye. So a person experiencing cycloplegia will not be able to focus on close objects. Now in the airway, it's going to decrease secretions, and in the stomach, it's also going to decrease acid secretions. In the gut, it's going to decrease motility, and in the bladder, it's going to decrease urgency. So we have already covered quite a bit of material so far. You may be wondering how to remember all of the effects of atropine. Now, what is the best way to memorize all of this? My recommendation would be to look back at our discussion of G protein-linked second messengers. If you know what activating each receptor does, then you can actually figure out what blocking each receptor does. So atropine simply blocks muscarinic receptors, so you'll get the opposite effect of activating these receptors. Thinking of it like this will allow you to study less and remember more on test day. So like I just said, atropine acts as the opposite of the parasympathetic nervous system. So it's going to act or mimic the sympathetic nervous system. The parasympathetic nervous system causes all of these bodily secretions, and atropine is just simply going to block all of these secretions seen here. Okay, still not done with atropine. Oh my gosh, what do we have here? A free question, you ask? Yes, that is right. This is an extremely common test question, so hopefully I have your attention for a few minutes because I'm going to get you the maximum pointage. Now, what happens during an atropine overdose or an atropine toxicity? Well, an atropine overdose would block the muscarinic receptors too much, causing the opposite of the dumbbells or the wet picture. So, an atropine toxicity can be remembered by this following mnemonic: hot as a hair, dry as a bone, red as a beet, blind as a bat, and mad as a hatter. Now, in other words, we're talking about the opposite of the dumbbell picture here. So, atropine toxicity is going to present as an increased body temperature due to decreased secretions, including sweat secretions. It's going to involve a rapid pulse, a dry mouth. It's going to have flushed skin due to peripheral vasodilation, which helps compensate for the increased body temperature. You're going to have cycloplegia. You're going to have constipation, urinary retention, and even disorientation. Now, why the disorientation? To remember the disorientation as an atropine side effect, you need to think about the association between Alzheimer's disease and the decreased acetylcholine levels. So from neurology, remember that Alzheimer's disease presents with neurofibrillary tangles, widespread cortical atrophy, and a decrease in acetylcholine. Atropine is going to decrease the amount of acetylcholine binding by blocking those receptors, thus giving an Alzheimer's-like disorientation. So I just want to emphasize this concept of a muscarinic antagonist toxicity, specifically the atropine overdose or toxicity. Don't be surprised if you encounter a question prompt on test day where a patient is going to be hot, they're going to be red, they're going to be blind, they're going to be disoriented, and they're going to be dry. So when you see this kind of patient, your mind should think atropine toxicity until proven otherwise.